Okay. All right, this meeting is being recorded. Before we begin, we would like to acknowledge that the land on which we gather is the traditional unceded territory of the Syilx Okanagan Nation and their peoples. I also acknowledge that you are joining us from near and far, and I want to acknowledge the traditional owners, past and present, of those lands as well. My name is Clara Dick. I'm the Education and Resource Leader at North Okanagan Hospice Society. Welcome to a research practice webinar. These webinars are co-hosted by the Institute for Healthy Living and Chronic Disease Prevention and the North Okanagan Hospice Society. Joan Batoroff sends her regrets. She usually is here with the Institute for Healthy Living and Chronic Disease Prevention. Just a note, if any of you have any questions, just type them into the chat box and Jaquetta will read them out after Barb and Paxton's presentation. So it's my pleasure to introduce Barb Pesut, PhD RN. Barb is the research chair in palliative and end-of-life care for frail and rural adult populations. Professor, School of Nursing, Faculty of Health and Social Development, UBCO Okanagan. We also have Paxton Bruce with us today. She's a UBCO Master student in Interdisciplinary Studies. Barb and Paxton are presenting Disconnecting Through COVID, Experiences of Older Persons and Their Volunteer Navigators. Barb and Paxton, I'd love to turn it over to you.
Thanks so much, Clara, and we're delighted to be here today. Our thanks to the Institute and to North Okanagan Hospice Society for the opportunity today. So as Clara mentioned, our topic is NavCare in the COVID context. My thanks also to many of our friends and partners that I see online. We couldn't do this work without you, and we're very, very grateful. So as Clara mentioned, I'm Barb Pesut. I will just be giving a brief introduction and then I'll be turning it over to Paxton. Paxton and Rowena have actually done the lion's share of the work on this project. They did the data collection and much of the analysis. And so I'm just delighted to have them here today presenting this topic. So maybe Paxton, on to the next slide. So we thought it might be helpful actually to give you a little bit of background to the NavCare project first so that you could understand the context within which we collected this data. So NavCare stands for navigation, care stands for connecting, accessing, resourcing, and engaging. NavCare is an intervention in which trained volunteers work with persons living at home with serious chronic illness to improve their quality of life. So NavCare volunteers do a number of things. They first of all connect with older persons in the home. They visit them to provide social support. They help to identify what their quality of life issues are and help them access resources that would help to improve their quality of life. And probably most importantly, they help older persons to stay engaged with life to the degree of independence that they want. So NavCare is all about living, making life more livable for people as they travel their chronic illness and ultimately palliative trajectories. So of course, with any project, we absolutely need to acknowledge our funders. This project has actually been in the works for about 8 years, and you can see that we have had some wonderful funders, both at the national level and more locally with foundations. Our current project is funded by the Max Bell Foundation. But again, I just can't stress enough how grateful we are to these funding agencies for the work that they've enabled us to do. So it's probably helpful to know a little bit about why NavCare was created, and it was created specifically in response to certain healthcare policy goals, and particularly those goals that relate to palliative care. So NavCare is really all about improving the quality of life of older persons living at home. And that's really important because NavCare is not about healthcare navigation. It's about navigating those quality of life issues that seniors experience as they're traveling the chronic illness trajectory. One of the main focuses is to provide early support for these persons. You know, we've talked about a palliative approach on the Canadian landscape for many, many years. NavCare is designed to intervene early with persons as soon as they're starting to experience the quality of life issues that attend a complex chronic illness. NavCare is also focused on the amazing volunteer philanthropy that we have in Canadian society. A number of policy documents have stressed the need to support volunteers to a greater extent. And haven't we seen this on the Canadian landscape, where we've just had this massive uprising of volunteerism in response to the needs that have arisen. And so NavCare provides a structure within which particular volunteers can exercise their gifts and capacities. NavCare is also designed to optimize available resources. We learned early on in our studies that there were often many, many resources located in communities that were very organic, but which people didn't know about. And so these NavCare volunteers really focus on trying to find those hidden or organic resources to support persons to improve their quality of life. And finally, NavCare is very much embedded within the compassionate community movement. The idea is to build social capital for individuals and their communities, and to really recognize that palliative care is everybody's business. And so to provide one program through which communities can mount a compassionate community approach. We're delighted to say we have actually 31 NavCare sites across Canada, right from the East Coast to the West Coast. And so we've done education and started the program in British Columbia, Alberta, Saskatchewan, Ontario, Nova Scotia, and Newfoundland. So we're very delighted about that, and we have plans for further scale out in future. So of course, we were in the middle of a number of intervention sites who were on the research process when COVID hit us all in March of this year. And so sadly, all of our volunteer face-to-face visits were stopped. And so we had to kind of refocus how we were going to look at this project. And so now all of our volunteers are having to do their visits through technology. I think a really important point in this is that the population that we serve within NavCare is also the population that is very much at risk with COVID. So we know that in particular, older persons with multimorbidity are some of our most vulnerable populations with COVID. We know that the physical distancing measures that are required are limiting the social interactions of older persons who are already at risk for social isolation. And probably saddest of all, depending on the statistics you look at, somewhere between 70 to 80% of all our deaths have been linked to long-term care. And NavCare does serve clients within long-term care as well. And interesting to note that Canada was twice the average rate of other developed countries, but that's a conversation for another day. I'm now going to turn the presentation over to Paxton, who will work us through the methods and the findings of this study. Thank you, Paxton.
Thank you very much, Barb. So this qualitative inquiry aimed to explore the experiences of our participants, so our volunteers and older persons, in the NavCare program during the COVID-19 pandemic. So data was collected through the use of semi-structured interviews. By telephone, our participants were walked through the aims of the interview during a phone call, and then the interviews were audio recorded and transcribed. Our participants were also familiar with this data collection process, which was very supportive. We were able to integrate the questions around the COVID context into our regular check-ins with our participants. We inductively analyzed our data, pulling out any emerging themes, and we also used NVivo as a data management software for this process. So 9 of our research sites were included in the sample. Out of a possible 46 volunteers, we interviewed 31, and then 17 older persons were interviewed out of a possible 27. Here's a breakdown of our thematic analysis that we will be going into in depth during this presentation, as well as a variety of subcategories within those larger themes. Our first very interesting themes was the participants' expression of existential experiences. And by existential, we mean thoughts, feelings, areas of self-reflection surrounding the pandemic. And a variety of these existential experiences really impacted our participants in a variety of ways. First, our participants spoke of the fear and uncertainty during the COVID-19 pandemic. So we heard that their fear emotions were really provoked by the virus itself. There is certainly an aspect of me that feels it's more of a fear pandemic than an actual coronavirus pandemic. Older persons described their fear and uncertainty around being in public and interacting in the public space. As well as alternatively, some volunteers spoke of not feeling that they were at risk or were not concerned about their well-being. Some of our participants even described the virus as a nuisance. So we had both of the fear and uncertainty as well as the lack of fear around this, the emotions that came from the pandemic. A lot of our participants also spoke to a sense of loss. So volunteers spoke to a loss of community and not being able to support their community by engaging in programming as they traditionally did. Older persons also spoke to their loss of purpose. So going to the grocery store, dropping off or picking up their mail. These were part of their normalcy and their routine, and the virus took that purpose from them as a result. As well as we had one volunteer describe a loss of experience. One of our volunteers did have a participant pass away during the pandemic. And so from that, they typically would have had interactions with that volunteer that client, towards end of life. They would have provided condolences to the family. They would have attended a service. And so with the shift of all of that and not being able to experience those, the grieving process was very difficult, and that loss of experience for that volunteer. Participants also reported mental health challenges such as loneliness, depression, disappointment, boredom, and even worry. There was an acknowledgement from volunteers that one could easily fall into a deepened sense of sadness, especially if they were prone to that already. Another volunteer commented on the decline in mental health and how that may deteriorate existing social relationships. Our participants also spoke to their reappraisal of time and in what ways they were spending their time. Many volunteers spoke of the impact of the pandemic on their refocusing their energy into their home and their family. Older persons also spoke to the importance of family and reappraisal of time with their family during the pandemic, whether they had the ability to have their family in the home. They spoke to the importance of that, as well as if participants didn't have the capacity to have their family there. So whether they lived out of the country or out of the community, they also spoke to this reappraisal of time and importance with them. There was also a bit of some of our participants reflecting on the disorientation of time, which was as a result of the change in their daily routine and how this sort of disorientated them during their daily activities. The data also showed disruption in healthcare for older persons. So they spoke to the changes either by shift or by complete halt in their home care services. And they described the frustration of this disruption. One volunteer who was previously helping a family member transition into long-term care described her hesitations and concerns about accessing long-term care. And our older persons also described fears of accessing their healthcare, whether it be appointments or going to the hospital in fear of contracting the virus. There was a lot of disruption and fear around this healthcare access as well. Another item that was discovered was around social interactions. So this included changes in physical contact and social events, participants requiring to calculate risk within social interactions, as well as their emotions about social experiences. First, of course, was the change in physical contact as a result of the pandemic. So overall, people were missing physical contact with their family, with their friends, and even their neighbors. One older adult spoke to the inability to hug their daughter and how that was impacting them in their interactions with them and how it was difficult. One of the volunteers talked about the shift in just interacting and the awkwardness of seeing a neighbor down the street. So where they would have traditionally either shook hands or hugged, now they weren't doing that, and how that created a bit of awkwardness in the physical contact interaction. This change in the way that our participants physically interact with people greatly impacted them, and they spoke a lot about that. So we heard about many of our participants needing to calculate the risk and navigate their social relationships. So many of our participants made personal sacrifices in order to keep themselves or their loved ones safe. There was also this discussion about competing priorities between health and social interaction. Participants also described the difficulty of this competing priority and ensuring that they were safe, that their family members were safe, and how to navigate relationships in this new way. So they talked about people having to know each other again in a new way, and so not being able to know if somebody had the virus or in what ways they were interacting outside of that relationship that they had created a bit of strangeness between existing relationships for our participants. There was also this discussion or a bit of a back and forth within participants around the uncertainty of precautions. So on one hand, they were very serious about ensuring their safety, the safety of those around them, but they also battled with interacting socially with other people. So how much of their health were they going to ensure, while also wanting to ensure social relationship and social communication. So this back and forth was also evident in calculating risk with our participants. Also had those understanding and normalizing this idea of a lonely life. So those who described themselves as introverted or who were living alone didn't necessarily reflect on any significant changes. People stated that they were either not missing social interactions or were actually enjoying the solitude. These people typically describe themselves as solitary souls or independent. And in some instances, it even legitimized participants' tendencies towards introversion or relieved them from some commitment in a social sense that now that they were no longer needing to do that, it was helpful for them normalizing this lonely life. On the flip side of that, though, when we asked older persons if there were any significant changes in their life as a result of the pandemic, many of them answered with, nope, no, not really, or no. And it was this idea that staying at home, whether it was due to health or mobility, not interacting with the community to ensure safety, a lot of these practices were already evident for some of our older persons. And so then when we moved into the pandemic, and all of it, more of the larger population was experiencing some of these impacts to their daily life, they reflected as, I've been doing this forever. One person said, I've been sort of preparing for this my whole life. So that was very interesting. Something else that we found was this volunteers' guilt over abandonment of their NavCare clients. So one volunteer said that they didn't want to be part of leaving her in a space that was more lonely. This halting of in-person visits and shifting to a virtual navigation without a transition, of course, there was no opportunity for the transition, really impacted the way that volunteers felt about their relationship or their job as a volunteer with their older person. And even though they were attempting to engage with them and communicating through phone or other forms of technology, they felt that they were letting their participant down in some way. Of course, there was a lot of changes to social engagements as a result of the pandemic. So reduced interaction in terms of family time, community programs, working, volunteering. This was expressed by our participants. And volunteers also described how much they missed their traditional face-to-face volunteer role, and how this shift in their volunteer role really impacted the way that they were feeling about themselves and about their purpose in the community, as well as the idea of impacting larger social gatherings. So things like birthdays and weddings, traditional family gatherings, as well as funerals or deaths in family. There's a few participants who spoke to their family members being unwell or passing away and being outside of the country or not being able to see them, and how this changed social engagement really impacted our participants. Another key area that we found was this idea of growth for our participants. So things that sparked innovation or new hobbies or new ways of moving through this pandemic. There were a few unexpected benefits for our participants. So spending more time with family, having opportunity for introspection and gratitude really transitioned into this closer contact with the immediate household. So for those that had family living with them, you know, sometimes our participants, their children, their adult children and grandchildren, because everybody was living in a virtual world, would be living with them for a period of time. And so this was an unexpected benefit for a lot of our participants. Participants also talked about using their time during COVID for new hobbies. So an example was a creative venture. One of our volunteers was starting their own kind of mask creating business and offering masks to the community. There were a lot of people who were also practicing virtues and kind of reflecting back on themselves, finding opportunities for self-growth that they had always wanted to do more intentionally, but with the busyness of life didn't necessarily provide the time. And so COVID did that for them. As well as this idea of returning to new ways. So a volunteer talked about all the old kinds of things of preparing themselves and keeping themselves prepared, that they thought that people would start to do that again. So this idea of ensuring food and storage and canning as an example of a new hobby. So these returning to old ways of in our home and the way that we provide and support was also evident. Another discussion that we found was this idea of our participants, both volunteer and older person, dwelling more deeply into their lives. And so having more meaningful conversations with themselves, as well as with other people in their life, whether it be family or with their volunteer or with other people in their community. So some of our bigger social issues, social topics that are going on in our world, of course, all influenced by the COVID context, but there was a lot of moving deeply into lives and a lot of introspection and reflection on themselves and things that are going on in their world and how they're impacted by them and how they want to impact them. As well as this reevaluation of the importance of life. So again, as I had mentioned about people having family close by and how important it was to them that they were able to spend time with their family, or those that didn't have an opportunity to have family close by, and speaking to the importance of interacting with them, staying connected with them, and how important it was to really focus in on what mattered most for people. We also discovered that everybody spoke to this shared adversity or resilience. So because everybody was experiencing similar changes in their daily lives, that there was a sense of shared adversity in the community, and even common humanity. A lot of participants spoke to people being more patient, more considerate, like in their daily lives, going to the grocery store or walking down the street. They noticed that people seemed to just all be on the same page, all going through the same changes. And so there seemed to be that shared adversity. Also, that older persons and navigators could build resiliency together through mutual support. So though the visits didn't look traditional and in a face-to-face context, there seemed to be this desire and this camaraderie around mutually supporting each other through this time. Of course, a key facilitator in shifting to a virtual communication would be technology. So there was a lot of discussion around that. phone calls were our most common technological method of contact between our older persons and volunteers. Interesting, of course, that Zoom and text were on the upper end. It was more common in terms of our general population, and but for our particular population of older persons, it felt interesting, as that wasn't necessarily a platform that our participants were familiar with prior to the pandemic. So phone being the #1 used, as well as the Zoom and text message after that. So what we understood was, if our participants had a foundational baseline knowledge, and this was particularly with volunteers, having this baseline knowledge with technology, they did report more of a satisfaction and an easier transition in using it to communicate. Many of our older persons reported the insufficient knowledge around technology and just no desire to shift in terms of what types of technology that they were using, and they felt that they were getting their needs met through a phone call or a text or even emails for some people. And there was also this idea of new ways of being with technology. So volunteers and older persons did speak to the fact that though the face-to-face was being missed, that connection was still possible through the use of technology, and that it was important to keep that. There was also this concept of hanging out with technology that was happening. The example I mentioned of one of our volunteers who had a palliating client who did pass away during the program. In those moments towards end of life, the volunteer and the older adult didn't have a lot of capacity to speak for a long time. So they were using FaceTime as their technological platform, and the older person could only speak for a few moments. It just didn't have the capacity to withhold a conversation through technology. And so the communication in terms of traditional would only last a few moments. And then the participant would like to just kind of sit and actually ask the volunteer to stay on FaceTime. And they just sort of hung out with each other through this platform. And so this was a really interesting finding, and I think speaks to how we may move forward with this idea of virtual navigation and how we're gonna make this work for everybody. Of course, there were some drawbacks to the use of technology. As I mentioned, the insufficient knowledge. So if we didn't have experience with the technology, we were less likely to engage with it or wanting to engage in that way. There were some actual physical ability level drawbacks to the technology. So whether it be a mobility or a respiratory issue that impacted the capacity to use technology for the duration or using it in a certain way. As well as the volunteers spoke to the decreased quality of their visit. So an inability to understand nonverbals or see cues or kind of see the whole picture when they're doing a home visit impacted the way that they felt. The visit didn't feel as quality as it was prior. Okay, and of course participants also reflected on the NavCare program itself within the COVID context and how COVID impacted the program. Some of our participants were satisfied with kind of this quick check-in idea, while others were happy that they were able to support a longer withstanding communication through technology. There was a decrease in the duration and the frequency of visits, whether it was due to capacity or just general desire to engage on technology, but this was evident with many of our participants. As well as prior to the pandemic, a volunteer navigator, when they would visit in home, provided some type of respite for our participants' family members in the home. So they were able to go to another room or do something in another space. And so this was also described as by our volunteers that they recognized that this was something that their visit in the home offered, and that this was lost due to moving to a virtual navigation. Older persons and volunteers also missed the unique and genuine nature of the NavCare connection between volunteer and older person. So given that the volunteer navigator is not a family member and is not somebody that's providing a specific goal or service within their visit, It seemed to have created a unique nature between this, and our participants spoke to the impact of this unique visit when they no longer had it in the home. And so this interaction where you could, speak about your feelings around death, or speak about what you were going through. You didn't want to be burdening your family, or the other people that were coming into the home didn't have the capacity to go through those conversations with them. They were really speaking to that they missed this, especially with the complexities of social interactions right now, that they were really missing this face-to-face, and that it just didn't seem to hit the mark as well with the technology. So we do also want to highlight a few discussion points following our analysis of the data. So first is that COVID wasn't all bad for all of our participants. So there were some positive influences. The examples of getting back to the old way of doing things or having more time to spend with family were described as positive influences with some of our participants. It's interesting because we tend to speak to the frustrations and negative components when we go through something like a global pandemic, but our participants really wanted to speak to some of the positive things that were occurring in their lives as a result. And I think that shows the idea of this shared adversity and resilience between communities and between participants was really evident by them wanting to speak to this positive component of the pandemic. Again, another interesting discovery was that COVID didn't, make a significant change to many older persons. So the idea that their life was very similar before the pandemic, and really shedding light on this vulnerability of this population and how important it is that we consider this vulnerability and recognize it, especially now that we're moving to more socially distant interactions. Another discussion that we wanted to bring forward was this idea of technology breaking the ground for hanging out. So typically we would use technology as more of a motivating interaction. So whether it be to connect with friends or family, or potentially a church group or a faith-based group, those were really motivating reasons to engage on technology. And because we were now required to use technology to interact with these motivating experiences or connections, it's potential that we can break ground for social service programs moving forward. So if populations such as older persons are now familiarized with technology, it could be that they would be more willing to sign up or interact with a volunteer program or a virtual program in the community as a result. And the final area of discussion was around this potential influence of vulnerability for experiences during the pandemic. And we could look at this as sort of a benefits scale. So positive accounts regarding the pandemic were more evident with volunteers than they were with older persons in our interviews. Comments such as having space and time for family, gardening, being outside were more evident with those who had, of course, the resources to do those things. Some of our older persons who had potentially more vulnerability spoke to the inability to get outside as a result of living in an apartment, inability to move because of mobility issues, not being able to leave their homes, or not having family around to support them. So it could be that, the more increased vulnerability that somebody has would be that they are reporting less benefits as a result of the pandemic. And though there has been an acceptance of this new way of interacting with virtual navigation in our program, it's not a sufficient replacement for face-to-face communication with our participants in the physical context. And this, I think, is a great way to just speak to the willingness and the importance of staying connected, but also the recognition that face-to-face communication is still being missed. Okay, thank you so much. I think I've spoken enough. I'm excited to connect with everybody and hear questions.
Great, thanks, Paxton. I'll just start my video here. There you go. Jaquetta, are there any questions in the chat right now?
I do have a comment. Just wanted to share that we had volunteers participating in different types of activities through technology, such as quilting together, and we even were doing Reiki visits. Both were very positive, and we are trying to explore more such activities.
That's great. Yeah, I think that's such a great example of creating community-based programs or connection. And the idea of potentially, yeah, hanging out and quilting together. It's such a great example. Thank you.
Yeah, and Bonnie, can I ask you to enter into the text box how you kind of broke the ground for people being prepared for that? So was that a difficult transition to help people learn how to just hang out online? Did you do any specific preparation?
I'm just looking at the chat.
Okay, so we do have another question. Can homebounders find loaner computers? I have encountered many seniors whose access to technology is a phone.
Yeah, absolutely. And we did hear from some of our participants or volunteers that even living in rural communities, so their access to Wi-Fi or their access to internet was not as sufficient to be able to do a video chat. So I think that there's a lot of exciting kind of community-based grants that are moving forward for an opportunity to have technology become accessible for those who don't have it. Yeah, and I'm hoping that would continue. I'm reading the chat as well.
Yeah. So how does one not feel like an intruder being online with others?
It's a great question. So an intruder can we, yeah, maybe elaborate on that question a little bit, but an intruder in their space, or because the nature of technology kind of decreases that connection in social context?
Right. I wonder if they're speaking to the discomfort of connecting in an online format rather than in an in-person.
Mm-hmm.
Yeah.
Yeah, should we let that person enter that into the text box? And I just want to go back to a question that I think that we missed. And I think the question was there anything in your findings? Are you surprised at your findings, from Roseanne? Is there anything you learned that had not been shared either through social media or in the news? And Paxton, let me let you take that one first and then I'll jump in.
Absolutely, yeah. I think some of our most surprising components was the use of hanging out in technology. I think I weren't necessarily anticipating that concept. It makes sense in theory that we need to try and understand how to make this happen, because of course when we were doing face-to-face visits, it was that really genuine back and forth social engagement. And another area that I would speak to in terms of surprising findings would be this recognition of older persons saying, this is how I've been living. And now it's really kind of comforting in some senses that other people in the community are now understanding what it's like to be socially isolated, to be kind of stuck at home or staying at home and not going to certain places in my community. So that one, again, was surprising, but very, very, very compelling.
Yeah, and the one I would add to that, because I was reflecting on the data too, and I kept asking myself, you know, are we really learning anything that hasn't been publicized in the media? Because there's been a lot actually out there around what's happened. And I think the thing is related to the way in which we get our information. And the media really has a tendency to, I think, focus on the negative aspects of things, because the problem is really what is sellable in the media. And I think the thing that really struck me in the data was how this has enormous potential for growth as well. And people were very, from what I could read of Paxton interviews, they were very articulate about that. So they talked about, you know, returning to an emphasis on some of the disciplines or the virtues that they had learned in an earlier time in terms of what it took to get through difficult situations. And I actually thought that was a very inspiring piece of the data and something that we don't hear very often within the media. So thank you for that question.
I'm curious, I know there's a few other questions there, Paxton, but what struck me was the volunteers speaking to that moment of switching from in-person visits to telephone or technology-supported visits. And it sounded like there was an element of moral distress for them. Was there any specific things that they mentioned that kind of walked them through that to feel like they could fully support their client?
Yeah, absolutely. So you're right. It felt really, I mean, the whole concept of shifting virtually for all of us in a personal and professional way it felt very abrupt, and it certainly did for our volunteers. And just that idea of our programs trying to understand how to move forward, and potentially even just the communication between volunteers shifted as well, because typically they were meeting in person to connect on their NavCare clients, and this shifted for our volunteers. So in terms of examples of how they started to feel more confident about their interactions virtually, I think it was very, very individual. So it depended on if they had guidance from their mentors within their volunteer organization was definitely helpful, and being able to reach out to them was important for volunteers. And even just working through this idea of it's not, you know, it wasn't their decision to stop having face-to-face visits with their older person. And depending on the capacity of their older person too, I think was a lot of reason for moral distress, because some of the older persons weren't necessarily like, well, I'm okay if you want to come, it's okay, I'm fine, I get that we're trying to have distance, but you and I can be in a bubble. And so, but the volunteer not having the ability to make that decision, of course, was really they struggled with that as well.
Okay, so it sounds like having in the moment support was really important to the volunteer.
Yeah.
And also, yeah, it's very multifactorial. Even the capacity of their client really impacted the ability to transition in-person support to
a virtual. Yeah, exactly.
Yeah.
Just having the support is a great kind of overarching statement. Support from their volunteer capacity or their volunteer organization, as well as just internal, like feeling confident in themselves that this is, you know, it's out of their hands, and how can they do just that they're doing the best that they can, that reassurance component.
Right. I appreciated how you listed all the different ways that volunteers were creative in connecting. I found it sounds like the volunteers really dug into their own personal strengths to be creative, to join with their client in a way that worked for their client.
Yeah, absolutely. They were.
Yeah.
Yeah.
One of the things I've been thinking about a lot through this process is, I'm sure a lot of us have kids that have learned how to hang out. So they've really learned strategies about how to hang out. And so what's really intrigued me is, you know, what can we learn from that younger generation in terms of how they socialize and interact with one another online, that we can, you know, apply to an older population. And so I sometimes think somebody needs to do a great research study on, you know, how kids really learn to hang out online and how that meets their needs.
Interesting. So pulling resources from the younger generations, from the folks that we support, and translating that back. That's a great question, Barb. I'm going to think on that one. Have you done any thinking in terms of moving forward with that hanging out concept and supporting the volunteers to work on that?
Yeah, so we're actually doing, one of our colleagues in Nova Scotia right now is doing a really great review on, you know, what are best practices for doing this with older persons. And so she's helping us actually work on a a project in that we're going to write a module. Basically, we're going to write a module for volunteers based upon the literature and the best evidence around how to do this distance technology between volunteers and older persons. So we hope to have that ready probably around February. They're quite far along the process.
Okay, that's great. So just back to, oh, sorry, did you have something, Paxton?
Oh, no, sorry. I was just looking through the chat box here. There's a few questions around how did we, how are you getting older persons to be receptive on technology, or how did that connection with technology? And it was really unique and independent, I think, between the persons. So the first part was definitely their willingness overall. So if they felt that they wanted to explore that or try that, some people just said, that's just not my thing. I just don't do the computer, so I'm just going to be on the phone and that's fine. And that kind of was the end of it for some of the older persons. But I think as we're hoping that this idea of if we can't have any physical interaction between each other in social experiences, then there's going to be that motivation to shift to an online platform. And I hope that will be a helpful way to transition older persons from using technology. But it really was, it was unique. And I think it was also the volunteers just wanting to meet the older persons where they were at. And that was really important too. It wasn't a lot of shifting into the technology. It wasn't a requirement. And so I think it was more of that really informal just connection about what was best for them was how it was evident at this time. Yeah.
So there are so many rich comments in this this chat. I almost wonder if we shouldn't pick this up and send it to everybody who participated today. There was also a comment of, I can't see who's on the line, so I don't know who I could connect to get more information around this. And there are just so many good comments in here that I wonder, Jaquetta, if there is some way that we can connect to everybody that participated today, or at least post some of these comments that are just so rich.
Yes, I can save the comments, and I'll figure out a way to share them. Yes.
Thank you. Thank you. Barb, we had started with Bonnie's comment about quilting together online, using online technology. She made another comment later, I'm just scrolling through right now, that they, where is it here? They were able to obtain tablets to lend to clients. However, there were significant challenges to getting these elderly clients who were not experienced with technology prior to the pandemic open to trying. A lot of fear of technology seemed to be present. Did you encounter any knowledge in regards to supporting older adults in using technology? Technology goes against the return to older times, doesn't it?
Yeah, and I think, it's, I think we'll look back at COVID-19 in some ways as the mother of invention. So when you think about what's happening, even with healthcare appointments now, where, seniors, and we've heard quite a bit about this, they don't have to leave their home anymore. They're getting scheduled visits with their physicians, and, it's such a positive thing for them. Many of them can now attend church services because they're online. They don't have to feel like disaffiliated from their congregations anymore. So I suspect there's going to be all kinds of literature that's going to come out in the next while around, not just within the volunteer space, but within the healthcare space and within, generally the social science space, around how we finally made this transition to what has really been a very foreign intervention for many of us that are a little bit older.
Right. Bonnie then connected hanging out to, this is a comment. Would hanging out not be similar to the concept of sharing space that we often refer to in hospice volunteer training? So it's just occupying that emotional space.
Yeah, so, Bonnie, my thing that I just I think about all the time is there's something about sharing that space that has such huge interpersonal communication that isn't verbal, right? And there's so much that that is just that you talk about how people do that shared space well, and so much of it is intuition based upon the presence of the person in front of you. And I mean, even us not really being in the same room today together with one another creates sort of a wall of distance that, I don't know about you guys, but I have consistently a hard time kind of getting past. It's such a different experience than being with all of you together in a room, and even such a sense of sadness when I see many of my colleagues online and I can't actually, you know, be in the room with you. So I think, you know, the thing is how do we take that grief and that loss around what is lost and envision something new around hanging out, and can we find new things in it that we can't enjoy now? And that's a big question for me. I think it'll take all of our heads around the table to figure that one out.
Yeah. And that goes back to grief theory, acknowledging the loss, processing it, and then reinvesting your energy into the next thing. So maybe part of it will just be an element of time, Barb, and Paxton for our volunteers.
Yeah.
There's another comment here from Corey. I can relate to the feeling of guilt for abandoning my client. COVID disrupted the routine of contact with each other, but also caused a lack of motivation and turning to my own family's needs and adjustments. That being said, the client I'm connected with and I have found a new space online to connect again. I like that idea of hanging out. Perhaps my client and I should cook a meal together. I could imagine that there could be great joy in older persons being invited into the whole family online.
Oh, I just love that comment. You know, that's so indicative of how people take a difficult situation and reframe it in a way that, and you know, I think in some ways, again, back to sort of the mother of invention, I think we're all learning things that we can let go and other things that we can pick up, and how to do that negotiation. And that's just a beautiful comment. Thank you.
Thank you.
And Paxton, it goes back to what you highlighted. There was actually a lot of positives that your research showed. And I found how you teased it out and shared those stories. We were really able to see that.
Yeah, it was this idea of unexpected benefits was very interesting. Again, like Barb mentioned, we're always reporting on the negative and the frustrations and the changes for the worse and those sorts of things. So it was really, really inspiring to have these positive experiences. And I am just looking through the comments as well, and a few people are mentioning this discussion of tech, like Wi-Fi and internet access and bandwidth, living in rural communities, living in more mountainous communities like the Kootenays. And I think, again, it's very important, and somebody mentioned here, it's not a luxury anymore. And I think that speaks to this idea of not only recognizing the vulnerability of the population, but just vulnerability of people in general, and how are we going to be able to navigate, because this won't be just now everybody gets a tablet and we're all ready to go. It's not going to be like that. And so recognizing those vulnerabilities and how we're going to ensure equitability in this type of program and virtual connection is another thing, as a definite next step about how we can do this. Oh, and Doug, Doug also is asking about, Barb, if you could respond, but how do potential NavCare clients find or apply for a digital volunteer program?
So at this point, I think probably most hospice societies, I imagine, across the country, at least the ones I've chatted with, have some digital outreach at this point. And certainly I should let you field this, Nav, because you've been tracking it better than I have, Paxton, but I think the vast majority of our NavCare sites that are still operating have also done this digital outreach.
That's right.
And you know that many of them have kind of tried to move back to the in-person face-to-face, but with what's happened within the last month or so, I think we're probably all resigned to the digital platform for a while. So yeah,
absolutely. Everybody's working really hard to understand, like, the quilting idea, or everybody's working very hard to understand how to offer programming, offer supports, offer connection in a virtual context for this population.
Yeah, and the thing that I'm really excited about is all of our NavCare sites have in some way recognized the need to reach out beyond their geographic areas. You know, in Canada, we have such a large population living in more remote areas where there are virtually no real services to support them. And so perhaps what we learned during this time of COVID, we can then apply to reaching out to older persons living in more remote locations where, you know, visiting on an ongoing basis just isn't a possibility. So, you know, it's time to develop best practices to really reach into every aspect of Canadian geography.
That brings me kind of, oh, well, we have a few more minutes, but one more question for me. You've talked a bit about best practices and developing a module for supporting older persons through technology. Is there any other direction that NavCare research is going that you'd like to share with us, Barb or Paxton?
Yeah, so
or is that not really?
No, we're just on the cusp of an announcement that we can't quite make yet.
Okay. Oh, I'm sorry.
No, that's okay.
I wasn't sure
But I can say generally that we've had an expression of interest to develop NavCare in a number of different ways, and we are moving in that direction. One of them is to support family caregivers of persons living with dementia. And we have a doctoral student working on that right now. We have another graduate student working on supporting caregivers of persons, of children living with life-limiting illness. So that's another direction that we're taking it right now. We are doing some adaptations for a Francophone population, and we're hoping that we'll be scaling it out more broadly, but we just are kind of in that in-between space where we think we're going, but we're not sure. But I can tell you we have 3 graduate students doing some incredible work right now in terms of adapting this particular intervention to very specific populations. So we're really, oh, and sorry, we have one more student who I'm very excited about this initiative. Cara Basil is looking at how this might work for Indigenous populations or not. And so she's going to take some time to work with talking circles in Indigenous communities to see if there's anything of this model that would be appropriate for Indigenous communities. So that's sort of our 4 areas of development right now.
Wow, that's exciting. Thanks for sharing, Barb, what you could share at this moment. The NavCare program, it's pretty amazing. And I appreciate you, Paxton, sharing your amazing research from those 2 and 3 months over March. It really, you really captured the experience and the stories, and your stories are so rich and really brought it to life and gave me a picture in my head. And I'm so proud of the work that you two do and making Canada a compassionate country. It's so inspiring.
Oh, Clara, I have to jump in there because honestly, we would be nothing without the people like you and the many people online that have gone on this journey with us. We're the shell. You are the people that actually make it happen. So my deepest thanks to all of you who have gone on this journey with us. It has been such a privilege.
Thank you so much for being here today and taking the time to speak with us. Has been really nice to connect, even though it's on a platform and I can't see everybody. It's still nice.
And one final comment here, Roseanne has echoed. Thank you so much. Lovely presentation. I truly enjoyed this Zoom. Such rich learning. So I think that's a great place to end. Barb and Paxton, once again, thank you on behalf of the Institute for Healthy Living and Chronic Disease Prevention and North Okanagan Hospice Society for sharing your work. And we look forward to the next iteration of the NavCare program.
Thank you, everybody. Thank you so much.
Okay, Jaquetta, I'll let you